you might anticipate. I'll let you go when you're scheduled to go. Great to be here. I'm Jason Leitch. I'm Scotland's National Clinical Director. I recognise many in the room, and what a fantastic day that the Chief Scientist has put together. I was thinking as I was sitting there, 1973. Who was, anybody here in 1973? Morris, were you here? Yeah, I thought you might have been. So I was 5, just about to start primary school in North Devon, England, and then 2 years later moved back up to primary school in Airdrie in Lanarkshire and saw, I was looking for the maypole because they taught me to dance around it in North Devon. And those of you who know Lanarkshire will know there's no maypole in the Airdrie schools. I was asked if I was a Protestant or a Catholic and I didn't know the answer. That was the big difference. But 50 years is such a long time. And what a fantastic session we've had, hearing some of those innovations, but also thinking forward. So this session's going to be a little bit more about solution, a little bit positivity, looking forward, but with the fundamental cover of collaboration. So we want to talk a little bit about collaboration and how that works. So I'm going to turn quickly to my left because there's 2 people here who you haven't met yet, I don't think. I don't think either of the remarks have spoken yet. So why don't we introduce them, and then I'll ask everybody one question each, and then you guys can have the rest of the time if there's any left. And then we'll stop about 1:45, hand to Anna, and she can send us on our way. How does that sound? So why don't the 2 marks introduce themselves and give us a little bit of why are you here, why do you care, and why do you care about collaboration in particular? But tell us who you are and what your jobs are first.
Okay, I have the pleasure of going first. So I'm Mark Cook. I am the co-chair of the Life Sciences Industrial Leadership Group, and I chair that with the Minister for Life Sciences. And the purpose of this sort of collaborative group is really building on the triple helix to try and ensure collaboration, cooperation, but primarily with a goal in mind. And the goal that we've been set and have been working towards is to generate 8 billion of revenue to the Scottish economy by 2025. And, you know, when you think about that, we're definitely going to do it. We might have already done it because of the lag in data. But something that we haven't talked about today is revenue and tax revenue. Because if we build or continue to build a very successful life sciences cluster, then that creates high value jobs. It creates people who work in the supply chain. It gives the young people who have been at school looking at STEM, it gives them an opportunity to get into a high value career. So as well as improving the health and wealth of the population, it really does do some great things societally. And of course, collaboration is critical because it's the opportunity to take these innovations to the world. You prove that they work here with the agility of the Scottish system, and then you can export them. And again, that's more revenue. And if we can make Scotland a more attractive place, we'll get inward investment. So many, many levers, and that's kind of my interest and passion with the £8 billion monkey
target
there.
On your back. Well, it's on all of our backs, maybe. We'll blame you if it doesn't happen.
Yeah.
The other Mark.
Hello, I'm the other Mark. It's part of a new policy. We're all going to be called Mark from now on. My background is I'm currently the Chief Entrepreneurial Advisor to the Scottish Government, but my background is I've spent over 30 years working in the tech sector, startups, scale-ups and internet economy companies. So why am I here? Well, truthfully, because Anna told me to come. But on a more serious note, we talk about collaboration. Collaboration we tend to think of as between ourselves, but what we need is what I'd call super collaboration, which is across domains. The tech and internet economy domain may seem far removed from where we are, but it's actually not that far removed. In that domain, you have to innovate to stay alive. I was a CEO in Skyscanner, and Google was trying to kill us every single day of the year. And of course, in the health environment we're going into, we're going to have to innovate as a core capability to keep our people alive and healthy. And you could say, well, it's very different because you haven't got the stakes aren't as high. But, if you're innovating on top of a platform that you regularly crash, Facebook crashed every other day, there'd be an awful lot of people out of jobs because the company would fail. So there's similar aspects at play. I think also a key thing here is that we're now living in what I call the exponential age, which is to say that things are changing at an exponential rate. The problems that we face are changing at an exponential rate. So I would venture to say that even the projections we've seen here are wrong, because they fail to take into account the spillover effects from other exponential crises on the planet. You know,
it's even worse, John. That's the news there.
It's worse.
It's even worse.
It's worse than you think, and it's later than you think. And that requires us to have an appropriate response. Now, the good news, Jason, is we're also in an exponential technology age. An exponential technology is one whose price point is falling exponentially and whose capability is rising exponentially. So our survival in all its different levels depends on where these two graphs intersect. And that's where we all come back into play. And if our response to that is a linear response, same response we'd have made in the 1950s, or worse still, a sublinear response, then we're all in some real serious trouble. So I think you should think of me here, this is what I tell my wife when she tells me I'm a pain in the ass. You should think of me as a constructive provocation, that's what I tell her, as to what might be possible from a process and perspective. Because, crucially, just to finish these opening remarks, we don't have a technology problem here. We have an abundance of technologies, just like I did in my domain. I always used to tell people that in the tech sector, we don't have a technology problem, we have a people problem. We can build anything we want if we can conspire together to do it. So as Bill Clinton would have put it back in his presidential term, he said it's the economy, stupid, when asked what the most important thing is. I would modify that to say it's the process, stupid. If our processes are sublinear, we're in big trouble, and I think that's the journey I think we have to go on, make them exponential.
I think we need you to provoke us. I think it's helpful. I think Chief Entrepreneur is also the best title in Scottish Government. It's not a high bar. Most of us have got rubbish titles, but it's great.
It's a title I personally hate. But
thank you for coming. So let me move to my right, and Tan, I'm going to ask you first. You contributed this morning. You've come a long way. So this is a really hard summary question, but knowing what you know of Scotland, and what you've seen, we had dinner with you last night. We tried to give you some illustration of what, and you understand our system a little. You know Anna well. Others have come to visit you. You know Andrew and David and others. What can Singapore teach us about collaboration quickly? What have you done that could accelerate our mission here?
Yeah, thanks. So with a huge caveat that I don't know Scotland that well. I would say we have spent the last 15 years in Singapore building a culture of collaboration. It never used to be that institutions would work together. It was, we won the grant and they didn't. So we have taken a deliberate policy for all large grants to promote cross-institutional, cross-disciplinary collaboration based on strengths, right? And we have two large grants, one which is more academically focused for translation, and one which involves industry. And for both, we require that. And when we first launched these grants, we took great care to say that the winner of this first big grant scheme we had was Singapore Gastric Cancer Consortium. So we didn't say that the National University of Singapore won it. We said the Singapore Gastric Consortium won it. And we had people from all the different places come and describe their part in it, and that kind of set the pattern for the rest. Now, I'm talking about this in some detail because there's quite a bit of sociology here that over time, and I'm quite happy that in the last 15 years, it has become the norm. So all large grants in Singapore have representation from all institutions. And in the last 5 years, we have taken the next step. Because what we find that the researchers are now working well together, but the institutions are often getting in the way. Because, you want to share data and your lawyers will tell you can't. You want to harmonize the costing of clinical trials and you're told you can't, So we need the institutions to step up to create a much more facilitatory environment for real collaboration to occur. And so we created a new scheme which provides support to do that. And the goal is then to enable our institutions and our researchers to be globally consequential in some specific areas. And in particular, we try to do things that are relevant to Asian populations and diseases. So this is what our journey has been. And the key point is that by ourselves, we can be big fish in a small pond. But what's the point? And what we need to be are the ability to compete in the big ocean, but we can only do that if we harness all our strengths within Singapore. And the role of the funders and the policymakers is to create the enablement that will allow our researchers, our clinicians to have the best chance of excelling. So that's kind of how we've been trying to address this, and it does require some differentiation, a lot of thought about differentiation. Why should Singapore do this? Does it matter? Can we compete because we're a small country? And then doubling down on what we do. And I think the final thing I will say is what we've also have endeavored to do is to move it at some scale and to sustain it over a long period of time. Otherwise, what we find is that we can start things and then after a while they lose support and people say, well, I mean, there's no real point because after 3 years, 5 years, support will end and then this whole thing will go. And so we tried our best to maintain a certain constancy in our direction, subject to people maintaining quality, competitiveness, and showing progress. So a more limited number of things, but to try to sustain them over a longer time.
It's really helpful. And you have the same population size as us.
Yes, 5.5 million.
Is this a diagnosis you recognise, Victor? So you have multiple roles. One is across the whole of 250 million people in the US, but you also have global footprints, and so you understand how other countries work. Is this a diagnosis that you recognise and the same advice you would give us?
Well, I'm very active in Singapore, as Chuan will tell you, and they have this Research Innovation Enterprise program, which is spanning 5 years,
yep,
and looking at where they want to be. And now I chair the group for Health and Human Potential, and they're looking at where the trends are, where the longitudinal programs are. And I think that's got a lot of strength, if you will, when you look at something that's committed over a long period of time. And then it's going to be renewed again, looking at what are the opportunities. So I quite agree with Chuan. I'm just thinking, this has been a phenomenal day, and I've heard so much innovation, excitement, lots of activities. So is it working or not, right? And I think when you look at your model of the triple helix, you got 3 components: academia, government, and industry. The question you need to ask is, in fact, are all the 3 components aligned, right? So as been said many times, leadership counts. So if I look at the stuff you are doing, which is quite amazing, it promises to transform health and healthcare altogether. And yet I get the impression that you're doing it, but you're really not getting a full buy-in of the clinical delivery side of things. So that alignment is so important, which means that the clinical and the research have to see what they're doing together is actually for the good of both, advancing, therefore, much better health and healthcare. Then there's the industry side. What do they care about? And so when you look at your assets, which are plenty, and we talked about this earlier about a single NHS, a great quality data, electronic health record, easy to access, innovation centers, innovation hubs, clinical research facilities, and so on and so forth. You've got a lot. And you've got pilots and implementation. And yet I still get the impression that you're struggling a little bit. So I think the issue to take a step back is to say, are all the 3 parties' interests aligned? And can we create a common mission that we all agree that that's what we want to be? This is where I think Singapore is unique in the sense, because there's no question the REI brings together HHS, or pardon me, MOH.
Ministry of Health.
Yeah, Minister of Health, A-Star, and, all the pieces together, industry, right? I think you really need a place where all parties agree this is where we want to go. So that's point number one. So you do need success. And I thought the iCare was just terrific. It was amazing data in terms of digitalization. Yet I'm hearing, well, we're not funding it again, maybe. So there's some things not moving forward in terms of alignment with the leadership who's funding this, or industry who's not finding enough value in moving forward. What's the issue here? I think one needs to ask the question. I think what Chuan said is really important, which is scale and sustainability. And you're the same population size as Singapore, and I know Singapore says, our population is not that big. Now, what kind of footprint can we do in terms of, Chuan is telling me that Andrew Whitty says United Optum's got a lot more data than he has for a whole country. So I think, as been said, that hypothesis generation with your smaller set of data, international collaboration, scale to a different level, whereby industry may find it even more interesting, right? You made this really interesting observation, you generated a possible direction, let's now collaborate broadly and see if we can prove it. And that may create more interest for industry. And finally, I think that the issue clearly is capital, investment capital and industry presence. I always think about how US started with biotechnology, and of course there were some anchor institutions like Biogen, Genentech that seeded the whole space, which become real size, skilled institutions. As you know, many of the innovations these days gets acquired by another large company and it goes offshore, right? I think how to create a large enough footprint, right, to have the kind of not only sustainability, but the talent that comes from these organizations. Because I would argue that in the United States, almost all the biotech industry started with these two companies, with executives and researchers going on to build multiples of them. So how do you actually achieve that would be another question. But what you've done is quite amazing. I mean, look at this center here in Queen Elizabeth. Look at the, I guess there's a what is it called, BioQuarter?
Yeah, that's in, we don't talk about that, it's in Edinburgh.
Yeah, okay.
talk about that question. Yes, I'm joking.
I think Peter Mathis would disagree with
you. He would, and so would Aziz. So would Aziz and Dr. Mora.
Yeah, but I think you do have those pieces.
Of course.
I think the question I'm asking is, let's take a look at how these pieces.
And Tan's advice is to increasingly bring those pieces together. Yeah. I think that's something that's shouted from this front row all the time. I hope somebody's writing down your wisdom, because it is quite wise. John, so what? How do we do that? Help us move that conversation forward a little bit. So yes to collaboration, yes to a country of this size. Are we overshadowed by our southern neighbour? I mean, can we not compete in the global game? How do we become more prominent rather than lose people to other places and kind of fight above our weight somehow?
Yeah. So that, I mean, I think that's the central question. So the first thing is that the life sciences piece, the UK is competitive. Bits and pieces of the UK are not competitive. So, and there is people stand up and say, oh, well, we're the best. Actually, the truth is individual institutions, hospitals, regions of the country are not competitive internationally, to be honest. And it's also true in America, because the strength in America of their biotech and life sciences are big chunky bits of the country. Yep. Boston and that bit of the world, that area around Gettysburg and Washington, Silicon Valley, San Diego. These are not small places. These have got big population bases. They've got multiple academic institutions. And together, that mix has made them the most competitive.
The engines for that.
That's right, exactly. So, and look, we've done pretty well. you know, in European terms, we're undoubtedly the leader in biotech. We've got 2 big pharma companies. Most countries have lost their pharma companies now, so we've got a couple of big ones, and you know, they both look okay. One, AstraZeneca, is the fastest growing on the planet, as you know. So you know, we've got some really good assets, but I think we've got to work together, because if we just splinter it up and try and pretend we're the best on our own, we're never going to win. So, you know, one of the things about the life sciences strategies, we've really tried to make it national. And it's interesting because we can look at any bit of the country and there's stuff that is really competitive that together adds up to something special. So, you know, you go to the northeast of England around, you know, the Sunderland and the pretty deprived bits of the world. They are really good at manufacturing, like really good at manufacturing. They don't do discovery science and they won't do clever, you know, antibody trials, but boy, can they manufacture. So you have to, I think, play to your strengths and use the whole of the UK as the platform to run with. And then actually, I think we then become really interesting. But, and to be honest, we're pretty close together. You know, it's not as if we're, you know, in America, yeah, to get from one coast to the other, no, you know, it takes you 5 hours. But, you know, in this country, you know, you can get from one end to the other in 45 minutes. So, yet, you know, so I really think that's going to be the game.
Unless you fly with Ryanair, it takes a bit longer.
Yeah, that's right.
Other airlines are available.
That's right.
We still make AstraZeneca. We still make Europe's antibiotics are still made 40 miles from here.
No, I knew that.
In AstraZeneca's factory on the coast.
I mean, so Scotland's got a terrific reputation on life sciences manufacturing.
Do you know what they build? Do you know what they make the penicillin on? We are the biggest customer in the world for Uncle Ben's rice. They make the penicillin on Uncle Ben's rice. That's just a free fact for you. That's absolutely true. So Denise, let's bring it to, not that this isn't reality over here. I'm not insulting this crowd to say it isn't reality, but your job is properly in the front line across the road, trying to take what this world is creating, this innovation, this collaboration, and actually embed it. So it's all very well David Lowe going to his work and doing a shift in the ED, but how do we take David's thing, where is he? I can't even see him now, there he is. How do we take David's thing and then give it to you so it's packaged in a way that your clinicians, your non-clinicians, your managers, they'll take it? How does it feel to be in your part of the world?
Well, when I think back 5-6 years ago, we were heavily criticised for not being able to work with industry in terms of the technology, and I think iCared was a research program, but there's been huge consequences, positive consequences from a technology and architecture point of view as a result of that. So we've changed our infrastructure so that we can work with industry and we can collaborate from a technology point of view, and we can plug things in to a platform, for example. So we've definitely developed in that respect, and where we've had success there for COPD, remote monitoring, heart failure, we've had real success actually. We've reduced bed days for that cohort of patients. You know, these patients are self-monitoring. We're workflowing all of that data through to the clinicians and embedding it into the patient record. So there's been huge progress there, I think. Our challenge is scaling that. And really trying to scale that implementation when services are so busy and challenged. So there's a number of things we can do. We talked about the technology there, but working with partners who are probably more agile than we are, addressing the risk appetite in terms of not just the technology, but the change and the transformation challenges that I think services have in terms of moving from how they work now and working differently can be really, really, really difficult when there's really long established working practices and processes. But certainly in Glasgow in the west of Scotland, the hub and the sponsorship we get from CSO, I think, is invaluable. We're able to take clinicians out of their job for a short period of time to really focus on that transformation piece and become those change agents, I think. And where we've had success, I think clinicians have really led led that conversation and convinced their colleagues. And we're trying to solve the big problems, COPD, diabetes, focusing in on where we've got big problems and articulating and demonstrating where this type of technology and collaboration can help solve the problems.
That's encouraging. You're telling us that this is the CFSD stuff is real.
Yes,
you're telling
absolutely.
us that is bridging that gap. I'm not trying to put words in your mouth for the guys, but that feels real. Although they did say it was a Formula 1 and it was a Formula 3 picture. So I just didn't want to correct your. I think it didn't look. It was a Formula E picture. Okay, I'll give you. So that feels real, though.
No, it is. It is. I mean, really practical things like value cases, business cases. Procurement was a real issue 5 years ago.
It feels different now.
Definitely. And taking us through that procurement process in a well-governed way, I think, is critical when we're talking about scaling these things.
Mark C, are you feeling that difference, or are your organisations, your member organisations, your pals in the industry, are they still saying this still feels incredibly hard, trying to break down the doors of the Queen Elizabeth or Edinburgh Royal or whatever?
No, I think there's been progress, and I think there's a great deal of credit to CSO's office for actually laying out the things that Scotland is interested in receiving, and if people do have something that hits some of the stated priorities, then people are interested to hear about it. I think that there's been a long legacy of sort of industry and health with a bit of suspicion, and I think that that's absolutely fair. But I think with the partnership approach that we're now adopting, we're getting past that, because we can find common ground where we both want the same thing, and the ultimate goal is to help the patients. And as long as we stay on that, it seems to work. It seems to work very well. There's always going to be a differential between something that is truly game-changing or moving the needle or hitting a priority, and something which is 1% better than what came before and costs 2% more money. So I think it kind of depends where you are on the spectrum. But if you've got something that is absolutely game-changing and will significantly impact a waiting list or a working practice and would lead to a system change, I think that we are finding that this is very receptive. And this is the sort of thing that obviously will attract investment from abroad, because the agility of the system, if you've got some of these big picture things, is very attractive.
That's encouraging too. So last word. We're just about finished. I'm going to let Anna come up and close us in a minute. But Mark, so be provocative. So do what you described at the beginning. What from your experience in other industries, and now here you are in Scottish Government, and today you have the audience of health and care professionals, and whether they're innovators and academics or people in the front line of care or people helping run this system. So what do we have to do to make what our two colleagues over here have said a bigger reality?
Well, I think
just a small question.
Yeah, that's a great question. Being bad at something's a choice. That's where we have to start. It's a choice.
I've made a living of that.
We'll move on from that point. I think you've done a great job.
Thank you very much. That wasn't what I was looking for, but I appreciate it.
Yeah.
I need it today in particular for obvious reasons.
But we do need to start from that reality. Everybody is at this conference because we are frustrated at our ability to innovate. Otherwise, you wouldn't be here. You'd be off enjoying the fruits of high-speed innovation. Nietzsche said that insanity is rarely...
Leitch or Nietzsche?
Nietzsche. You might have said it as well, but I suspect you didn't. He said that insanity is rarely to be found in individuals. It's always to be found in teams, groups, organisations, and countries. Now, what do I mean by that? We know that when it comes to the rate of innovation, we're woefully below where we need to be. It reminds me of that Woody Allen film where he gets 800 years in jail at the end of the movie, but with good behaviour he expects to get it cut in half. If we were to double the rate of innovation, it's woefully too slow. Yeah. So we've got to understand the gap between what's needed and what we are. But this isn't a physics problem. It's not like I've said, let's try and get to Jupiter and we've got to work out how to survive for 5 years and all this kind of stuff. It's a human societal system problem. So in other words, it's a choice. We choose to go at this speed. And if you step outside this current industry, and I've got enormous respect for everything that everyone's doing here, I don't have a fraction of your knowledge in this space, But if you step outside and look at how other industries have solved process problems, you could do well to study manufacturing environments. They would tell you things like, John said we add doctors, we slow things down. Why is that? Because that's not where the bottleneck is. So it's very, very common, this is insanity, to work on things that are easy to solve because the actual bottleneck in the system is a bit too politically difficult, so we're just going to do displacement stuff. And everybody here is frustrated about that. Another great example is, why did we go faster in the pandemic? Well, we were partly inspired by your nightly broadcast, Jason. It wasn't just that. It was also because we chose to subordinate to the task in front of us, not to our functional allegiances. But after that, we all fall back into our functional. I can't meet you till next Tuesday, and I'll need to make sure. So this is what I mean by, I translate the niche statement into none of us is as dumb as all of us. We're all individually super smart, but when we come together, we conspire to operate processes that are woefully suboptimal. We complain in private groups to each other, and we still operate them. So that's the opportunity that's in front of us. And that's what I would urge us, in a constructive sense, to take on.
So Victor put his hand up for a final remark. So
I'm not sure it's final, but anyway, I do want to end up the right note because it's been a very impressive day. And watching Scotland, Sonia, I've been working on it for quite a while, really having all those forward-moving innovations is really important. And I totally accept your word that these innovations are changing healthcare, right? The digitalization and the many other things. My reaction is only the question about how do you bring all the parties together? And that, I think, is where the struggle is. Not so much in what you're doing alone. To me, we would love to see it happen in parts of the United States and, in fact, having it go forward. So keep going. You're going to end up with a greater health system and a greater health care. But the question about collaboration with industry, to me, is a related but not exactly the same question. And so it comes back to Mark's question about what is it that is a win-win for all sides? What do they need? And I think that's where, back to Mark's question, I think that getting the right parties together, and I know you're trying to do that, or you've done this, to really understand each other, because not everything is commercializable. I talked about that earlier. Actually, what you do is great, because you actually end up with better health. But maybe that's not enough for the market to think about this. So if you really want to go that direction, you're going to have to think along, what is it that we can offer them that actually would be, quote, commercializable.
Keep going seems like good advice at the end of a panel, doesn't it? Thank my wise and trusted six, would you?